Welcome to Magnolia Medical Minutes, your local source for medical advice direct from the experts at Magnolia Regional Health Center in Corinth, Mississippi. I'm your host, Andy Stevens of SuperTalk Mississippi Media, and today's special guest is internal medicine doctor, Dr. Priest. Thanks for joining us.
Thanks for having me, Andy.
So today our topic is hypertension or high blood pressure. So could you give me some details about that, some statistics about it?
Yeah, so blood pressure affects over 50% of the adult population. It's highly prevalent in our community specifically. Blood pressure readings above 130 or over 80 is a sign of hypertension. And over time, there's direct correlation that it can increase our risk of atherosclerotic disease, or in other words, plaque buildup in our vessels that cause stroke, heart attacks, and kidney disease. So it's an important modifiable risk factor, and I'm glad we're talking about it today.
How does a person find out if they're impacted or at risk of hypertension?
So first, patients can find out that they have hypertension at their primary care physician office or practitioner's office. Usually it requires 2 readings of a blood pressure higher than 130 over 80 on 2 separate occasions. The second question, who's at increased risk? Anybody who has comorbidities, such as already having cardiovascular disease, having had a stroke or a heart attack in the past, diabetes, those that may be overweight or obese populations are at increased risk of hypertension as well. It obviously is more prevalent as we age, so those over the age of 60.
What does someone do to manage this if they've been diagnosed?
We found that if we can control blood pressure to the levels recommended, that we can reduce your risk or a patient's risk of heart attack, stroke, or kidney disease by about 10% just by reducing the blood pressure. First of all, making sure you're having an annual visit with your primary care physician, number one, and following up if you have a high blood pressure reading with them in regards to what to do about it. It's really about a healthy diet more than anything. I think all of us, including myself, could benefit from a healthier diet. And then a physician or a practitioner may decide that you need to start an antihypertensive medication.
And we don't need to forget exercise too, right?
Yes, of course. We all need to exercise.
What would be a good goal to shoot for and the blood pressure to be at? What do we want to be?
Evidence suggests that the lower your blood pressure is, the less risk you are at cardiovascular disease. Blood pressure less than 130 over 80 is ideal. However, your physician may ask that your blood pressure be less than 120 over 80.
Well, thanks again for your time, Dr. Priest.
Of course.
Be sure to join us again on Magnolia Medical Minutes for your local expert medical advice direct from the doctors at MRHC in Corinth.